That's a really good question. I'm Dr. Brooke. I'm a board-certified psychiatrist, and I recently had a video get some traction where I talked about how it's not a great idea to be starting and stopping Lamictal abruptly. Lamictal, the generic name of this is lamotrigine. Lamotrigine is an anti-seizure medication. We also use it in psychiatry world for mood disorders. It's very important with this medication that you do not start it abruptly or stop and start it abruptly. Whenever you start lamotrigine, you're going to start it at a really low dose and taper it up over a number of weeks to months. Why is that? That's because lamotrigine, when started abruptly, carries a risk of something called SJS, or Stevens-Johnson syndrome. It's a very rare but very serious side effect that involves getting a rash all over your body, that involves changes to your organ function, fever. You need to be hospitalized if you have SJS. Again, very rare, but very serious. The messy part with getting a rash and lamotrigine is that there's also about 10% of people that will get a completely benign rash. How do we tell the difference between big scary rash and kind of benign rash that I don't have to worry as much about? The big scary rash, SJS, is going to be a painful rash. It's going to hurt. It's often going to involve mucosal areas, so your mouth, your eyes, your genitals. In the benign drug rash that about 10% of people will get and we can manage more reasonably, that is going to be more itchy, not painful, and it's going to be exclusively to kind of your regular skin. You're not going to have it in your mouth or your eyes. It's very common to get a more benign rash, often improves with time. People can sometimes, just take some Benadryl when they're starting or adjusting the medication and it clears up on its own, versus SJS, which is like big and scary. The main thing we do to prevent the big scary rash, the SJS, is that slow ramp when you start the medication. So if you stop it for any reason, you can't just start it up again. So to say, oh, I was on 200 before and I tolerated it just fine. I never got that big scary rash. I never got the benign rash. I'm just going to go ahead and start up 200 again. No, you have to re-titrate it to minimize that risk of developing SJS. And if you miss 1 or 2 doses in there, that's usually okay. We'll just kind of continue with the ramp. But if you miss 3 or more days, then you should let your doctor know to determine if it's okay to start it up again or if you need to restart the ramp. I usually advise my patients when they're starting this medication, don't get any new laundry detergent this week, right? Don't go foraging in the wood for mushrooms. Don't be exposing yourself to new potential allergens that could give you a rash on their own. Try not to introduce new potential allergens when you're starting really any new medication, but especially one like this where we're really keeping an eye out for allergic reactions. If you did develop the big scary rash, it's probably not a medication for you, but if you were with somebody who had the benign rash, it was itchy, it was mild, it wasn't involving mucosal areas, you can often continue to try it or retry it if it was stopped. There is evidence showing that people who are retrialed on lamotrigine after it was stopped for rash, over 80% of them tolerate it the next time and can continue on the medications. The specific questions or concerns should really be directed to your doctor. I'm Dr. Brooke, and my whole channel is Cook with Dr. Brooke, where we mostly talk about the connection between nutrition and mental health outcomes. And so I sometimes make videos about other mental health topics, about medications, about psychotherapies. But if any of that sounds interesting to you, and especially if you're looking for that nutritional psychiatry content, then I hope you'll check out my page and find something that is educational and inspirational to you. Take care of yourselves, guys.